combination is the right strategy. Combination in general. Combination for target agents and combination for immunotherapy. And next challenge will be the sequencing of this combination. About the combination with target therapy, it was really interesting that this combination is able to delay the resistance. And now we have a progression-free survival of almost 1 year and a little bit more if you look at the new data also from the COBRIM trial. And this is of course important. Consider that a few years ago, in 2010, the median progression-free survival was 1.7 months. Now we have 1 year. And also 1 year we can reach with the combination of immunotherapy. But staying with the target therapy, another important news is that with the combination of BRAF inhibitor with the MEK inhibitor, we have also a reduction of the squamous cell carcinoma that is one of possible side effects due to the paradoxical activation from BRAF inhibitor. So we have a more potent combination with less side effect in terms of cutaneous squamous cell carcinoma. That said, we know also that the combination of BRAF and trametinib have an important impact on overall survival because the median overall survival for the combo BRAF and trametinib was 25.1 months, more than 1 year. And also from the phase 1-2 trial of the combo BRAF and trametinib, we know that there is a tail in the course, with 38% of patients alive 3 years. We know that these patients are patients with good characteristic, with normal LDH, with a low tumor burden, with less than 3 sites of disease, also if one MOC. But it is important because this category of patients we know that can have also a long-term response with target therapy. About the combination of immunotherapy, this is probably the most interesting part because with this combination we can have the fast impact that normally we have with target therapy and the long duration response typical of immunotherapy. Unfortunately, at the moment we don't have overall survival data, but we know that there is also an interesting progression-free survival, shrinkage of the tumor, very interesting combination, about 60%, and also that action may be earlier, deeper, and longer. And of course, we have a price to pay, toxicity. The impact of grade 3 and 4 adverse event in this combination is 53% or 55% in the 2 different experiences from the phase 2 randomized trial of the combinations versus EP monotherapy or the 3-arm phase 3 trial of the combo and nivo versus ipilimumab. But it's also interesting that patients who stopped the treatment for causes different from progression, that is to say, for toxicity, in about the 68% continue to respond, even if they perform just 1 cycle. And this is important, and we will have some questions that we should answer for this, like the duration of the treatment. And this will be the next issue. But just a few hours ago, we heard other interesting data about the sequence of immunotherapy. Nivo versus nivo, and then EP versus EPO, and then nivo. It seems that the first sequence, nivo and then EP, is a little bit better in terms of efficacy, in terms of response rate, and also in terms of PFS. But if you look, the grade 3 and 4 adverse event in this sequence is 50%. So it's similar to the combination. Consider that this sequence is the treatment nivo, then wait 2 weeks, then give EP, or vice versa, EP, wait 3 weeks, and then nivo, and continue nivo after the induction. So at this point, the question is, if we have the sequence and we have not a reduction in the percentage of grade 3 and 4 adverse event, which is the better choice because we have the combination and we have the sequence. But while in the combination, the kinetic of the action, as I said, is earlier, deep, and longer. With the single agent in the sequence is a little bit slower. It's probably if I should vote for a schedule, I would vote for the combination because as medical oncologist, what I want is to have earlier, deeper, and longer response. This is our goal. And having the same toxicity, of course, I would be encouraged to give the combination.